The project name is acid reflux. Now we are going to learn about the process of digestion. When food enters into the mouth, it is chewed by the teeth. Then the food is mixed with salivary juices to form bolus, which enters into esophagus, and by peristaltic action it enters into stomach. And here, in response to the food, HCl is secreted into the stomach, by which the remaining food is digested, and the food enters into small from stomach it enters into small intestine, which has three parts: duodenum, jejunum and ileum. From small intestine the food enters into large intestine and finally leaves the body through rectum. And in small intestine, gallbladder secretes bile juice into small intestine through biliary duct, which helps in the further digestion of food.
Spleen.
In healthy stomach, there is a lower esophageal sphincter at the lower end of esophagus, which is muscular sphincter, which closes when food, so that food doesn't enter into the esophagus. When there is a loss of tone in the lower esophageal sphincter, the hydrochloric acid secreted in the stomach regurgitates back into the esophagus, which results in the formation of GERD, which is called as gastroesophageal reflux disease, which occurs due to chronic acid reflux. In acid reflux, here see, the acid is entering into the esophagus like this, and which will damage the lining of esophagus, resulting in chest pain, heartburn and sour taste in the mouth. The treatment for lower esophageal sphincter disease, if there is obesity, then there should be lifestyle modifications, and we should not lie in a prone position, supine position for 1 hour after eating food. And these are surgical procedure and new procedures for acid reflux. Normally the food enters like this. After the food enters into stomach, the lower esophageal sphincter should close. As there is loss of tone of lower esophageal sphincter, we are now introducing a magnetic method which closes the lower esophageal sphincter, so that the acid doesn't regurgitate into the esophagus, to reduce the chances of gastroesophageal reflux disease.